All right, so good afternoon, everyone. Welcome to this month's PHEd Talk. My name is Arne Burns, and I am the Health Education and Training Specialist here at IPHA. Today's PHEd Talk is titled The Drama with COVID-19 Vaccines, and joining us today, we have Dr. Felicia Scott-Wellington. Dr. Scott-Wellington practices in the Department of Pediatrics at UI Health and specializes in adolescent medicine, providing healthcare to teens and young adults ages 12 to 25. Her interests include vaccine preventable illness, injury prevention, and adolescent health disparities. She believes in patient-centered approach, which includes family support, youth confidentiality, advocacy, and above all, comprehensive adolescent healthcare. Dr. Scott-Wellington's ultimate goal is to provide healthcare that aids in the successful transition into adulthood. So with that being said, I'm going to go ahead and turn it over to Dr. Scott-Wellington.
Thank you guys for having me. Hopefully you guys can all hear me okay. You can put up the slides for me and we can get started. You can give me the thumbs up. I can see the slides. Cool. So I like the title of this, The Drama with COVID-19 Vaccines, because a lot of times in my office, especially, I'm a provider that deals with adolescents and young adults. And so they ask me things very openly, candidly, and they have a lot of questions. And then I always invite them to bring information that they have found from outsiders so that we can have an honest discussion about it in our office and during the visit. So today we're really going to be just talking about just that, the drama with COVID-19 vaccines. Next slide, please. So what I like about this slide is that it reminds us that there are still people who have been hospitalized throughout these last 3 years. I know that in the beginning of the pandemic in 2020, a lot of people, there were stay-at-home orders, people were isolating, people were staying at homes. There was a lot of news coverage about hospitalizations, about deaths. That occurred from COVID-19. And so I think that over this kind of 3-year journey, a lot of people have been believing that that no longer is an issue and that, the days of 2020 where people were hospitalized for COVID just really isn't happening anymore. And so what this slide really just goes through is by age range. So the first bar being the 18 to 49 years old, the 50 to 64, 65 to 75, 65 to 74 and over 75, and just showing, the rates of hospitalizations. And this is in 2023. So from January to June of 2023, showing that in the orange bars, that there are, people who are unvaccinated are still being hospitalized. And the blue bar, kind of above it, showing that they are vaccinated, but they have no bivalent booster. And I think that probably was a bigger issue, as COVID-19 continued to mutate, right? So some of the people who might have gotten the first series for whatever reason, a lot of my adolescents and young adults, they might have gotten the first dose of whatever vaccine in 2021 because it was required to travel, it was required to get in concerts, it was required to go to gyms, but they never got anything after that. They never got boosted. And so I always remind them so you're still part of the population that's at risk. Although you're younger than some of these bars, a lot of my adolescents and young adults, they travel to visit parents and grandparents. They go to church, they go to other venues where they might see these older age ranges. And so this really is just kind of reminding us that, unvaccinated, vaccinated without boosted, they're still at higher risk than the updated bivalent booster or fully vaccinated group from being hospitalized. And of course, the over 75-year-old patients being at greatest risk. Next slide, please. COVID-19 associated hospitalizations, the rates increased in all groups since mid-July, and that's probably one thing to remember. So although in the other slide I highlighted that, it's the over 75, I want to make sure that I'm not sending the wrong message saying that if you're under 75, you're kind of free of the possibility of being hospitalized if you get COVID-19, because that's actually not the case. Hospitalization rates are highest in older adults and in infants younger than 6 months. And this this is probably a conversation that I have with a lot of my family. So if I see a family that comes in with a teenager and they also have like a young baby, a lot of my teenagers, especially throughout the pandemic 2020 and 2021, a lot of them got new baby brothers and new baby sisters or twins. Two of my patients, they got twins. And so we do a lot of discussion about just making sure that we protect, all people. So, right. So we vaccinate you because now you have new, younger than 6-month people in the household, because they are at risk of hospitalizations, despite what, you might be hearing outside. Most children under 5 years of age hospitalized with COVID-19, they actually had no underlying medical conditions. So this was something that we heard quite a bit. Remember, in the beginning of the pandemic, they were saying, children were kind of like free of getting really sick. And so a lot of parents were choosing not to vaccinate their younger kids. And then they were showing that the ones that were hospitalized, or the information that was spreading is that the ones that were hospitalized had some type of underlying medical condition. And so this really is just a reminder, like, kids under 5 years old are still being hospitalized with COVID-19. Many of them have no underlying medical condition. A higher proportion of hospitalized children and adolescents aged to 5 to 17 years have underlying medical conditions. So yes, they do have, but there are also some without any. And hospitalized adults usually have multiple medical conditions. And of course, as you're older, as you age, there's kind of like more things that are able to happen to you, might have happened to you because, you're journeying through life. And so just remembering that that's also important as we ourselves as adults, our parents, our family, reminding them the reasons why they should get vaccinated. So you are still at risk of being hospitalized if you get sick with COVID. COVID-19 continues to cause severe illnesses. And I think that a lot of times we are hearing information like, oh, I had COVID and I was fine. I took some Tylenol and I went about, my day. And that's great if that is, the scenario that you find yourself in or other people have found themselves in. But there are also other people that end up in the hospital. I had some patients who families thought that they, as teenagers, were too young to be vaccinated, although they vaccinated themselves. And one of them actually ended up in the hospital with blood clots because COVID-19, the virus itself, can kind of sometimes cause people's blood to clot and increase risk of having clots. And so, it really was like a hard discussion that the family had after he was in the hospital. Like, we thought that he was too young to be vaccinated because the information that we got is that kids and teenagers really don't get sick from having COVID-19. And we really just want to remind you, like, nope, they continue to get sick. They can have severe illness. And if they're not vaccinated, we should urge our families, our patients, and everyone else to really get vaccinated because it can still happen. And most children and adults who are hospitalized with COVID-19 since January of 2023, they had not received an updated booster. I will say that in my office, now I have another cell to pitch at them, but the last bivalent booster before the newest one came out in September, it was a hard sell. I would tell them about it, and if they had one or two vaccines, they really just were, the rates were down for a second. I feel like they're actually popping back up. I've had a lot of positive patients, family members, friends, colleagues test positive more recently over the last few months. But let's say if you fast forward over to like early summer, a lot of them just were like, people aren't getting sick anymore. I really don't need a booster. And so it really has been like this kind of like long conversation that we've been having about the importance of being up to date on whatever COVID-19 is available. Next slide, please. All right, so this, I like this because it actually shows it in age groups, of course, remember showing you or illustrating to you that the rates are highest in those 75 years and older, followed by that of infants younger than 6 months old. And so again, as we think about how movement happens in the world and in life, a lot of times people are like, okay, I'm going to get this group vaccinated, but I think that this group is protective. But a lot of us, we move in families, and in families, there's this variation of age. And so, I'll give myself and my family, for example. So me and my husband, we have two young kids, and my daughter was out of school yesterday for whatever reason, they had yesterday off. And so my dad, who's retired, helped watch my daughter, but he also then went to go visit his father. So my 5-year-old has been around her grandfather and her great grandfather. And just with that one day off, she has been around, varying different age ranges. My grandfather is 90 years old. And so sometimes people forget that kind of like movement. They're like, oh, me and my husband, we live in a house with 2 toddlers. My toddlers, they don't go anyplace except for around us. They don't need to be vaccinated, but me and my husband will get vaccinated. And sometimes I just remind them like, okay, so there are people over 75 who are at highest risk, my grandfather. And so although you say you live in a household where it's you and your husband and you have 2 young kids and you do everything to keep them safe and they're not around people when they're sick, something as simple as a day out of school allowed my daughter to come in contact with my father, who's not 75, he's younger, but still. And then my grandfather, her great grandfather, who's over 75. And even something as simple as that, going to the store. And so sometimes my families don't think about it that way. And so I like this slide because it reminds us that we really have to try to protect us all, protect our whole family, protect those people who we interact with. A lot of my adolescents work at grocery stores. They work at various different places where they might have contacts with various different age groups. And so it really is important for kind of like the community at large. Next slide, please. So this one is COVID-19 associated deaths in persons by underlying health conditions. So again, just looking at the numbers, and this is from January to July of 2023, and breaking it down into various different age groups. Again, highlighting that the over 65, more vulnerable, more at risk, going from 2020, 2021 to 2022. But also showing that the younger age groups, it's not like they have no risk, that their mortality doesn't happen. And I think that that's something that we don't talk about a lot. A lot of times when we are talking about COVID-19 and COVID-19 deaths, a lot of information, at least that I get in clinic, is that such and such died of COVID-19, but they were older, they were in that vulnerable population that were over 65. And although that may be true, this graph is also showing you that there are other populations that are vulnerable too. So even as young as down to age 20, right? So 20, 25, 45, everyone really is at risk. And we need to be mindful of that as we are, choosing, what to do, how to move, whether to be vaccinated or not to be vaccinated. And I remind my patients of that as well. Like, no, you're right. So that over 65 is more vulnerable, but that doesn't make you invulnerable to these kind of like negative sequelae from COVID-19. Next slide, please. All right, so vaccination status amongst age groups. So children, adolescents, kind of like 6 months to 4 years, the 5 to 11, and then the 12 to 17. When I've given talks about vaccination, about kids under 17, I get a lot of questions about why the numbers look like this. So why do we think that we have like this in the 12 to 17-year-old, we have like a larger percentage of, people who might be vaccinated but have no booster, or unvaccinated if they're younger, 6 months to 5 to 11 years old. And I think that it's kind of multifactorial. So as you guys know, especially in the beginning, everyone was like wanting the COVID-19 vaccine. We had to wait for your age group to roll out. I know Stephanie and I were like part of the groups that were just waiting for the younger kids to be approved because we both have younger kids. So, there was a period of time where like I was able to get vaccinated and my parents and grandparents were able to get vaccinated. And then my younger nephew, who's 11, was able to get vaccinated. And then my kids are like young, 3 and 5. And at that time that they were vaccinated, I think they were like 1 and 3. We're just waiting and waiting and waiting. So part of that might've been a lag behind of like, the younger kids having less information about being up to date, being boosted and all the rest of that because they were added to the pool later. So I think that that's one piece. But I think the other piece is really that parents, well, I guess it's 2 parts. Parents feel uncomfortable making the decision for their younger kids about being vaccinated against COVID-19. And although I don't see kids ages 6 months to 4 years or 5 to 11 anymore, the youngest I see is age 12. a lot of times parents, when they are talking to me about their teenager, they ask me about their younger kid. Like, would you, have you? And I speak from personal experience. And I think for them, that's helpful. Like, yeah, so let me tell you, not as a doctor of a 6-month-old, because I don't see that age anymore. But when my son was vaccinated, he was 1 year old. And let me kind of like talk to you about that, and like the things that I was worried about. A lot of times they worry about how to fit a COVID-19 vaccine and boosters and all the rest of that into their normal vaccine schedule. So if it's a visit that they normally need to get, 4 vaccines, why would I give them another one? And so I think that these numbers that we see in the younger age range, 6 to 4, 5 to 11, really is multifactorial. The rollout was later. Parents are really hesitant about making this decision for their young child. The fact that they have to get other childhood vaccines that might be mandatory for daycare or mandatory for school leaves them kind of caught in the middle, and they usually choose not to give them the COVID-19. Sometimes they choose not to give them the flu shot. And then there really is this information that is told over and over again that young kids aren't getting sick, that they get a cold, but they end up fine. And if that is the case, then I'd rather not give them vaccine that they heard might do all these things versus just giving them Tylenol or Motrin for a fever if they actually get COVID, because young kids don't get hospitalized. And so, sometimes it takes a little talking through that information or misinformation with the parents so that they actually realize, like, nope, it still happens. Your kids being unvaccinated and going to daycare and going to school actually puts them at greater risk. Next slide, please. So this is last year, so 2022, 2023, the respiratory virus season, which is, we are entering upon, it's upon us now, I guess I would say. So usually prior to COVID-19, so let's go back to 2018 and before, usually the things that, doctors see around the season is an increase of influenza, A, B, whatever, and then RSV. So respiratory syncytial virus, especially in a pediatric clinic. And so what this information shows us is that, last year we had a pretty rough year where there were a lot of patients, children coming in with more than one illness. So this black line at the top is like combined. The red is COVID-19, the blue is flu, and then the green is RSV, right? And so a lot of our patients that we were seeing, especially throughout the fall, so again, reflecting on this time last year, so October to about January, there was a peak in like all these various different illnesses. And so we know that every fall we offer flu shots to our patients, and a lot of them get vaccinated against flu because they don't want to get influenza. There is now availability for people to be vaccinated against RSV. And so it's just a reminder, like, COVID is no different from the rest of that. If you know that every year, the flu shot is available at fall because it decreases your risk of getting influenza if you were to be exposed to it, COVID-19 is no different, because what can happen is that if you get COVID-19, it doesn't preclude you from getting these other ones. And having a double infection or triple infection from various different viruses in the fall can sometimes, make the whole family really sick, allow you to, miss work. Sometimes there were a lot of young kids that were hospitalized with double infections last fall. And so really it is just trying to make sure that this year is not like how it was last year. Next slide, please. And so this is a graph of kind of like common pediatric preventable diseases. So this is the deaths per year in the United States prior to the recommendation of the vaccine. And comparing it to COVID-19 vaccine, which is actually interesting because depending on the families that I talk to, a lot of them are like, you can give me all the vaccines for school, but do not talk to me about the COVID-19 vaccine. Don't talk to me about flu. Even though it's weird, because I will say over the last few weeks, I've been getting more people say no to COVID, but yes to flu for whatever reason. And so just this is really just reminding you, like, say, although we are vaccinated against hepatitis A and meningococcal, they won't even let you graduate from school if your teen doesn't have 2 meningococcal vaccines and varicella, and that, the negative outcome of these diseases are bad, and we want to make sure that we prevent our children and young adults from having these illnesses, that the deaths per year really are significantly less than in COVID-19, right? And yet people are still hesitant, questioning about why they would get a COVID-19 vaccine, but more open to getting the meningitis vaccine. And so really what we're trying to do is trying to make sure that the information that we're getting spread across vaccines is equal. Like just as important as it is to get you a meningococcal vaccine before your child graduates from high school and a varicella vaccine, right, before they enter preschool or before they enter kindergarten, COVID-19 is no different, right? Because we're really trying to protect you against, or you and your child, you and your family against COVID-19, which can cause deaths, and on average more deaths than some of these other vaccines that we have seen in the past. Next slide, please. All right. So, what do we know about COVID-19 vaccines? And this is probably the reason that you guys are here. So, there's an updated one. So, variants are here to stay. What is a variant? It basically, viruses, which COVID-19 is a virus, they're really smart. And so, whenever whenever we make a medication, whenever we make a vaccine to protect our bodies against it, they mutate or they change, right? And so, in the beginning of the pandemic, people were just like, oh, we hope that COVID-19 doesn't mutate and we get a vaccine and we're able to eradicate it. But, scientists were like, it's a virus. Viruses mutate, just like flu mutates. The flu shot that we got last year is not the flu shot from this year, is not the flu shot from 5 years ago. They change the flu shot every year because they know influenza is smart and it changes. And COVID-19 is the same way. So variants are here. They're here to stay. But just like how we changed the influenza vaccine, we have the capability to do that with the COVID-19 vaccine. And so the vaccine that we have, the newest one that was authorized, has been based off the variants of concern that we have identified. And so to take a few steps back, so variants of concern basically means that even if the COVID-19 vaccine changes, sometimes it changes and it causes us no harm at all or less harm. The ones that we're concerned about is that if a COVID-19 virus was to change and it causes like negative outcome. And so scientists study which ones these are, and those are the ones that they targeted to make the vaccine. And so that's what this newer vaccine is, like the ones that kind of like wreaked havoc early in spring last fall. Let's target those so that if our bodies see them again, if there starts being increased cases of that type of variant of COVID-19, that we're able to have antibodies or we're able to have some type of immune response against that. So it's been almost a month, which is weird because I was just like yesterday. So September 11, there was approval, for the new kind of 2023-2024 formula of the COVID-19. So there was the BioNTech one that was issued to Pfizer, and then the Spikevax, which was issued to Moderna. And then in the very next day, September 12th, the ACIP voted in favor of recommending the 2023, the 2024 COVID-19 vaccine to everyone 6 months and over. And then the CDC also signed off. Next slide, please. Bivalent Moderna and Pfizer vaccines no longer are authorized for United States use. And so what does that mean? So you remember the booster that I was trying to get all my teenagers to get last year? Like, you got to get boosted, you got to get boosted. The ones that they were saying no to. Many places no longer order that. They have no new stock on it. I work at University of Illinois. Kind of like when we were anticipating the 2023-2024 newer version come out, we kind of stopped ordering new stock because we knew that this old bivalent booster would no longer be used or authorized. So this is just reinstating that. So any vaccine that you're going to get is going to be the newer vaccine. It's not going to be the older bivalent one. The FDA authorized for the 2023-2024 Novavax. I'm not sure if you guys have any familiarity with that, if you yourself or somebody who is vaccinated against that, but that will be determined by the FDA, and CDC recommendations will follow. Next slide, please. I can't see the next slide. Do you guys see the next slide and I don't? Oh, there we go. All right. So this really is kind of just, if a lot of times we get asked questions about like how many vaccines do I need, and I think that is kind of a difficult question, especially if you're not like the healthcare provider or healthcare worker that are providing vaccines. So this really is just like a more simplistic view of it, and the next slides kind of show you more specifically if you're interested. But so like if you're unvaccinated and you're younger, the take-home message is that they need more vaccines. And again, another reason why some parents might not be getting their child vaccinated, like, oh, I got to give them 2 doses or 3 doses or whatever. And so we might have to like talk parents through, you know, that part of things. Like, I know getting 3 doses, if you want your kid to have Pfizer and they're 2 years old or 3-year-olds, getting 3 doses, I know that might be hard, but let me tell you all the reasons why this is a good idea. And don't wait until they're 5, right? So if they're 6 months to 4 years, if they're getting Moderna, they need 2 doses. And these are like, I'm not vaccinated. I have never had a vaccine at all. The older one, if they're getting Pfizer, they need 3 doses. And then over 5, they're just going to get 1 dose. And then if they're previously vaccinated, they're going to get 1 dose of Moderna or Pfizer, as long as they're over 6 months of age. Next slide, please. So this slide kind of just shows it in more detail. And again, this is not for you guys to memorize or know or anything like that, but just kind of reiterating what I said. If they're unvaccinated and they choose to get Moderna, they're going to get like 2 doses of the newer 2023 variant of COVID-19. Again, this is in the younger 6 months to 4 years old. If they are unvaccinated and they choose to get the Pfizer, they're going to get 3 doses spaced at this time. So over the period of 8 weeks, they would be done with the series. And then if you go down to the bottom, let's say I was previously vaccinated. Let's say I had 1 dose or 2 doses of Moderna. To finish out the series, all I need is 1 dose of the newer 2023 version of the COVID-19. And then if you are previously vaccinated with 1 dose of Pfizer, or 2 to 4 doses, just depending on how many you have. If you've had more doses, you need only 1 shot. If you've had less doses, so if you only have 1, you need 2. So the take-home message for this slide is that the younger kids probably will need more than 1 vaccine. So if someone said like, yeah, I really thought about getting my child vaccinated, I'm just not sure. It's 3 years in the pandemic. They had COVID twice already. I don't know if they should get it. You say, you know what? Kids are still getting hospitalized for COVID-19. It's really important for you to get it. There's a newer variant out, and they're like, oh, but I just don't want my kid to have so many shots. You can talk them through it. Like if they had 1 or 2 before, they might need less than they need previously. But if they haven't had any at all, then you're right. They might have to have a couple, but that's okay. You can take it 1 step at a time. You can talk to your doctor about the spacing in between it. Like sometimes there's like a range. You can do like 3 to 8 weeks between the first, or some families might opt to wait a little bit longer. And so there is some there is some conversations that parents can have to help them feel more comfortable in their younger age range if they want their kids to be vaccinated. They're just worried about like having it with other vaccines or the timing interval being too close. And so that should not deter a family who is looking to get their younger child vaccinated. Next slide, please. And then, of course, immunocompromised patients is always a little bit more complicated. I will say that most of my immunocompromised patients, most of them are on board. Like, say, if they're oncologists or they're nephrologists or endocrinologists, is like, you need to get vaccinated. Most of them have, in some way, somehow been vaccinated, and most of them are pretty close to up to date. If they aren't up to date, it's usually because they kind of got lost in the guidelines. Do I need 2? Do I need 1? And so probably the take-home message from this is that if they are immunocompromised, means that their immune system is weaker for whatever different reason, whether it be like the state of their illness or medications that they're on, they will probably need more vaccines, which is okay because they need more vaccines for other things. And so I remind parents of that too. Like, okay, so it's not just COVID-19, meningitis B, how sometimes, other families might only need 2, your child needs more. Protection against pneumococcus, some families only need 4, your child needs extra ones. So whenever your immune system takes a hit, you need more protection. And so this should not be something that's unusual for our families. Next slide, please. And then this is the 5 to 11 years old. This is getting closer to my age range. Again, I only see patients 12 and older, but the reassuring part for families is that once they make it to age 5, really what we're looking to do is get them the newest dose of the COVID-19 vaccine. And so if you have someone's like, oh, my kid's like 5, 6, 7, 8, 9, whatever, you say, all right, so if you want to get them vaccinated, the cool part about it is that they more than likely only need one dose, right? They only need one dose if they're unvaccinated. If they've been previously vaccinated, they can get their one dose of the 2024 Moderna or Pfizer, and then they're done. And for some parents, that's very reassuring. Like, oh, I don't have to start the series over. I don't have to do this. Like, nope, we're going to give you this new one, and then you are caught up to date because your child has made it over that barrier of being 5 years old. And that is great. Next slide, please. And then, of course, if they're immunocompromised, and you can like throw that in there, like unless they have some underlying medical condition that would make them, vulnerable to disease and infection, they might have to get more. But if they're not and they're over age 5, then they only need one dose of whichever you choose. Next slide, please. And then, of course, my age range, 12 and older, this is the only thing that I actually carry in our adolescent clinic is, we give them one dose. So if they come in, they're like, oh, I can't remember. I have my card and I got one. I can like all that. We're like, that's all right. Well, we have the newer version right now. And if you got Pfizer and you want to continue on that brand that you have, you just need this updated booster and we consider you up to date. And a lot of them are surprised, especially if they kind of like get lost in the recommendations along the way. And so they're like, so I just need one? Like, yep, you just need one and we'll get you the newer one and you'll be on your way and I will see you next year and we'll talk about this all over again. And so, that is usually like a sense of relief for families when they, get to this point. If they've been previously vaccinated, the biggest take home message is we want to get you the up to date vaccine so that it has the variants in it that has been circulating in the, more recently, that hasn't been getting people sick. So I'm glad that you got the other ones. I'm glad that you were committed to it in 2022 and 2021. Kudos to you. But we really want to make sure that you get the up-to-date booster because you're still at risk of having infection and disease from this variant that is circulating now. Because they might ask you, why do I need it if I got all my other ones? I don't want the new one. So it's the same reason why we would recommend the flu shot every year, even if you've gotten flu shot last year and the year before and the year before that. Next slide, please. All right. And same thing, immunocompromised patients 12 and older, it's not as easy as one and done. They will need more. And I usually talk my families through that. And I will say this, by far, this is like my easiest conversation to have is with my immunocompromised patients because they kind of have been used to needing more vaccines for other reasons. And so sometimes the negotiation that I have is spacing. So some of them just don't want it as close together. And so we kind of like go through the range like, oh, we have, I can give it 4 to 6 weeks apart or 8 weeks apart. And they might, opt to do it at the later range. So that is that. Next slide, please. All right, commercialization. So what is commercialization? And I think this is one of those things that like everyone's saying, sometimes people understand, sometimes people don't. But basically when the vaccine was originally manufactured, put out there for, all of us to receive, there was kind of like a coverage from the federal government. That's why we had all the mass vaccination clinics. You can roll up anywhere. You can sign up on whatever vaccine doc or whatever. Everyone was like signing up. Everyone's trying to get it. And no matter who you are, where you came from, you were able to get the vaccine from various different places. But commercialization has happened. And so although you can get the vaccine, you just have to know where to get it from. So most places that see pediatric patients, so that's under 18, they are signed up for Vaccine for Children or VFC. And so Vaccine for Children is able to provide COVID-19 vaccines to children who qualify at no cost. So the same way that we give other vaccines, and you don't necessarily get an itemized bill when your kid goes and gets like a physical for 4 years old, is the same way that they would be able to get the COVID-19 vaccine. So they go in for a physical or they go in for a nurse visit, and they want to get vaccines. So under 18, most places with Vaccines for Children are able to provide that for children with no additional cost. For those adults who have no insurance, they can also have access to COVID-19 vaccines at no cost, but they have to do it through the Bridge Access Program. And so they can get immunizations through like state facilities, so state immunization programs, local health department. If you look in Chicago specifically, they have, you go on their website and it says, we're no longer doing mass vaccination sites, but these are the sites that are available for people who have no insurance or have public insurance. And so I always tell my patients that are a little bit older, because I see patients until 25, and some of them are kind of like caught in that gap of insurance coverage and they're no longer covered by vaccine for children. Or sometimes I'm talking to them on the verge of losing their insurance. And so I usually kind of just help talk them through that website saying, oh, you can still get it. You just can't get it, right here, right now in the office, but let me help you navigate that space where you can go find it. And then for everyone else, so myself included, my patients that are covered until 25 underneath their parents' plan or whatever, they can get it the same way they access other vaccines. So when I do a physical, I bill for a physical, and part of an annual exam is to doing vaccines, and COVID-19 is included in that. Next slide, please. So pandemic overload, information, and infodemic. This is interesting because, that really is the part that we are at now. So as we advocate for people to still get vaccinated 3 years into the pandemic, those who are unvaccinated 3 years in, they have a reason for being unvaccinated. Whether that reason is, something that we like agree with or support or not, it is irrelevant. But what we really are trying to do is like, what information do you have that I can possibly help you try to navigate through? Again, if you're willing to have the conversation. Some families really are not willing to have the conversation at the time that you ask it. And so for those patients, I just say, okay, so I'm going to give you space not to talk about it today, and that's fine. But, every time you see me, I'm going to go over vaccines. I'm going to go over your health because, I'm your doctor. I care about you. I care about your health. And so don't be upset with me. Don't be offended if I ask you this question about the COVID-19 vaccine again. A lot of my families laugh because it's at least me giving permission to like discuss it again, but also giving them space, to like have whatever kind of like beliefs that they have about not getting the vaccine. But on the other hand, sometimes I give my family space to like say whatever, like, okay, I don't have my child have the vaccine because of this reason. And they'll pull up websites and they'll pull up TikToks and they'll pull up all types of things. And I usually, it takes more time, but I usually try to sit down with them and kind of just go through to make sure that they're getting the correct information and they're making a more informed decision. Next slide, please. So misinformation versus disinformation. So when people are spreading misinformation, they're often believing the information that they're sharing. So they're like, okay, I actually believe this. And so I'm going to tell somebody else. And so disinformation is crafted and disseminated with the others with the intent to mislead. So there are some people out there, they're like, okay, I know that this is incorrect, but I want to encourage people not to get vaccinated for whatever reason I want to do that. And so that I will purposely spread this information. I will say that most of my patients come in with misinformation that we have to talk to. And you might find yourself in scenarios when people have misinformation and, knowing, and if you don't know the answer to whatever their misinformation is, that's fine. But knowing how to like find that information and what websites to go to navigate them is probably the biggest point of this all. I had a patient tell me that she didn't get the vaccine because it's like a metal chip that goes in your arm and you become magnetized after that, wherever the spot is that your injection was, a magnet sticks to that. And so I spent like 15 minutes in clinic trying to run around looking for a magnet. And I was like, oh, I just got my shot. She had told me this like maybe a couple of days after I got my one of my vaccines. And so I spent like 15 minutes trying to find a magnet. And I was like, is this actually true? I was like, let's go find one. She was like looking at me like, oh, is you like odd? And I was like, no, like if this is something that you heard, let's actually like just try to like put this to rest. And you can have your own other reasons for not getting the vaccine, but I need to like put this one to rest. And so I finally find a magnet. I put it in my arm. Of course, it slides down 8 million different ways. I told her to put it on. I told her to put it on the side, the back, whatever. And she like laughed at it, right? And she was like, I don't know why I believe that, but She was like, I guess I was just reading into it. And I kept reading and reading and reading. And people were like showing me on TikTok. I just thought it was true. And I was just like, okay, so you can have a reason for not getting the COVID vaccine, but can we at least check this one off your list? Because this is not true. And I was like, you see, like, because I still had like, I didn't have the Band-Aid on, but like I had like a little pinpoint dot. I was like, you see, this is where I got a shot. This is, like not anything else. And she's like, no, I see like your scar from where you got your shot. And I was like, okay, so let's push past this one or whatever. All right, next slide, please. And so I like this slide because I feel like it's interesting. So disinformation campaigns are deliberate. They're meant to, confuse people, to change behaviors like not getting vaccines. And then they follow themselves up with websites. So I've had lots of family come in showing me like tweets or information or like blogs that people write. And then when you look at the references, they have like all these websites. And so this is just a list of like these top low creditable sources that you will see a lot of times at the end of blogs, or people call them articles, but they're not articles. They're like something, like information pieces that people write. So not like a scientific article of something that was studied, but more just like I'm putting these words together on a paper and writing it very eloquently, but it's actually not a scientific article. And then they'll put references at the end of various different websites. And so, just be aware of that sometimes people might come with information that looks very legit, and they believe in it because it's structured in a way that looks very legit, but it's from places that are meant to confuse them and low credibility sources, which just makes everything really confusing. Next slide, please. And making sure that, we are aware that they are a lot of like mainstreaming of the anti-vaccine movements. So, I'm not sure how much many of you guys are on social media, but our patients are inundated with this from every which direction about why they shouldn't get it, about the reasons why some process of not getting vaccines is better than the other. And so it leaves patients in this very confused state. Like, who do I believe? Who do I not believe? This kind of sort of sounds right. This kind of doesn't sort of, sound right. And so, really what I try to do with my family is I say, okay, let's take a deep breath. Let's pull all of this stuff back. And at the root of it all, tell me the things that you're most afraid of, because I feel like a lot of times families are fearful or concerned or confused about something, and then these kind of like outside sources kind of just flood their mind, and it becomes overwhelming. And it's better to not make a decision about being vaccinated versus making the decision and having regret. And so I like when my parents say, the reason I haven't got my younger one vaccinated because I just don't want something to happen and live with that regret. Like, no, okay, that is the real reason why you're not getting your child vaccinated, not these other things that you brought in here. Let's talk about that. Let's, sit there in that space and see if we can navigate it. Because that is more helpful to, to us and your child than any of these kind of like other information pieces that you've brought inside. Next slide, please. And remembering that some of these anti-vax or anti-vaccine movements or non-for-profits, they actually are profitable, right? And so I think that sometimes people forget that. Sometimes information are put out there to confuse you because people have their own personal agenda, but sometimes it is to make a profit. And so this slide just shows you, like some of the more reputable some of the more reputable anti-vax non-for-profits campaigns, and how you see the kind of like slant going up after 2020. So after the COVID-19, so after the pandemic, the COVID-19 vaccine comes out, how it's like drastically different. So the last line says the non-for-profits that survived on operating budgets around a few $1 million just a few years prior are now ranking in more than $10 million each. So sometimes there is a hidden agenda or personal agenda for some of the anti-vaccine campaigns that are out there because, it has been profitable for them to spread misinformation. And so, we just really have to be mindful of, protecting ourselves, our patients, our families for falling into like this period where they're just so confused that they are making a decision based off of information that's not correct. Because there are people who are purposely trying to mislead our families and ourselves against vaccines, not just COVID-19 vaccine, but all vaccines. And so we just want to make sure that that message that we're getting is clear, and that we are making sure that we support our families as they're trying to filter all this information. Next slide, please. All right, so increasing vaccine confidence. I think that this is one of those things. I feel like my families who have been vaccinated against one, with at least one COVID-19 vaccine over the last 3 years, sometimes you just need to like re-inform them. But for the families who have not been vaccinated, it really is just going to make sure that we are increasing confidence in the thing that we're recommending. So when people spread misinformation, they often believe the information that they are sharing. This information, however, is crafted and disseminated to mislead others. An example of this is that if a political leader claims that COVID-19 is no worse than the flu, despite knowing that this is otherwise, this is disinformation. However, when an individual hears this and believes it and shares it, that's misinformation. So one person said this to purposely mislead you, and then the other person, they heard it, they believed it, and then they spread it, right? Because they actually believed it, not because they're trying to misinform. And so the important part of us, part of this kind of like whole talk, is that a strong recommendation from us, whether that be healthcare workers, community, any type of like public health activists, we really just need to make sure that we are being used as a trusted messenger. So we need to talk about the vaccine. I have used the approach over these last few years of being personal with the vaccine. So not just necessarily quoting data, but more like, I got it, my 1 and 3-year-old got it, my dad got it, my grandfather got it, right? So if you need an age range reference, and then I talk about side effects differently, I say, well, I didn't feel this, but my husband felt this, and my child felt this, and then somebody in my daughter's preschool felt this, right? Because I feel like our families are being so surrounded by like the scientists. I mean, COVID-19 put us in a situation where people who had like no medical knowledge were left to interpret a lot of scientific knowledge, and it became very confusing. For some people, it worked great because they learned a lot. For some people, they just became confused. And so that information is already out there. Which one is more effective? Which one is less effective? What are the numbers on this? So explaining that, I feel like, is not what my parents want to hear. It's not what my families want to hear, because they can look that up and they probably know it better than I do. But what they really want to hear is like, how did a real life person, somebody I can see, touch, and feel, how did they navigate making that decision? I talk about when people in my circle have had pauses against vaccine. I talk about, how they've overcome that, how they didn't want this, but want this. I have 2 cousins that started off being vaccinated and now they refuse to get boosted. And then one of them got COVID and was in the hospital. I talk about that too. And sometimes, families really just want to hear real life, kind of like how we navigated the space of being vaccinated. And I feel like this increased vaccines confidence, and it helps to combat this misinformation and disinformation, because we're telling like real life stories of like how it affects us, how, why we got it for ourselves, why we believe in it, and all those other things. Next slide, please. And so I think it's really important, when we're talking about increasing vaccine uptake, simplifying the schedule, which I think that's been my like key approach as I'm dealing with adolescents and young adults. They love the fact that now, things are more simple. So alert patients when vaccines are coming up. So I told everybody, like in August, like we're getting a new one. So when I see you in a couple months and I asked you about the flu shot and the COVID shot, you only got to get one. So I've been like pumping them up before they come in. And so we do automatic return visits. So some of my patients who might have said, yeah, I want it, like when I was talking about in August, we then set alerts so they can come back when we, get the vaccine or whatever. So some of them scheduled in October, some of them scheduled in November. Implement outreach, so phone calls, mailing letters, text reminders, anything that can just remind them. Because sometimes people are like, okay, I want it, but not today. Next week, I got to work, right? And then they get sick, and you're like, oh, I should have got it, right? So same thing like with the flu shot. They're like, oh, I should have got it because I knew that blah, 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 blah. And so the more that we can kind of just like help remind people, especially if they're on board with getting vaccinated, like, yep, you should still go do it. Do you need me? Is there anything I can do to help remind you to go, and get vaccinated? Be patient, educate, encourage, listen, find answers, common ground. I love the approach of a common ground. It's not a one size fits all approach. Sometimes people really just want to get to be heard, right? So I'm not getting vaccinated, not because I want to get in an argument with you. I don't want to get vaccinated because I have all these reasons that no one is willing to listen to. And so it's easier for me to say, no, I don't want the vaccine, doctor, than to explain to you all my reasons. And so I usually counter that, like, oh, we're 3 years into the pandemic. Tell me, why haven't you got vaccinated yet? Right. And so a lot of times my patients look at me odd, like, who wants to hear my story 3 years into it? I'm like, I want to hear your story because I'm assuming a person who has not been vaccinated in the last 3 years or 2 years or whatever has a reason. And I just want to know if there's anything that I can help you with or any information that I can give you that might make that different or might add to the information when you're trying to make your decision. And then celebrate getting vaccinated. Anybody who has had a difficult time being vaccinated, I always like give them a high five. Sometimes I'll like text or not text, but like message my patients who have had, no, no, no. And then they finally get it. I was like, oh, I saw that you got it on the day I wasn't here. So excited. Because patients really want to know that they feel supported. Families want to know that they feel supported, especially if they make a difficult decision like that. Next slide, please. And then I think we talked about this. So using motivational interviewing, so it can help people with mixed emotions, feelings. So using open-ended questions like, tell me why you haven't, or tell me, tell me your story, and then listen to them and then try to summarize. Okay, so the reason that you said that you haven't gotten it is because of this. Is there anything that I told you today, anything that I can tell you, or any sites or information that we know that are reputable that I can direct you to? Sometimes I'll just leave a visit like, okay, go read this and then tell me any questions. Go look on TikTok and then read this, and then the next time I see you, we'll like compare notes between the two things that you saw, and we'll talk about how to kind of navigate that space of what you just heard and read and saw. Next slide, please. And I think that is it. Thank you, guys. I don't know if there's questions in the chat, but you can tell me if there's any questions. You guys can type it in the chat, but now that I'm done, you can also like do the hand raise and say it or just ask me questions.
I'm not seeing any questions in the chat. But I do think there was like an extra slide here for this.
Sorry. Yes. So this is our the Illinois chapter of AAP conference is coming up next month. So for those of you guys wanting to learn more information just about great pediatric issues, then you can either scan the QR code or go online and register.
Oh, Arne, I think you're muted.
Sorry. Sorry, thank you. Does anyone have any questions for Dr. Scott-Wellington? I'm going to stop sharing my screen here. Okay, if there are no additional questions, Dr. Scott-Wellington, thank you so much for giving this presentation. Very informative. I was messaging my mom. I was like, we probably need to go ahead and get the kids their booster. just in case, as we're entering into the season. So I know I really appreciate it. Thank you so much. And then thank you for everyone who joined us.
My kids are getting their booster in a couple weeks, and I cannot tell my daughter. She's gonna scream her head off, but it's all good. It's all in love. I gotta remind her it's all in love.
Exactly. Exactly. Well then, thank you all so much for joining us. Just as a reminder, our presentation is recorded and then will be uploaded to our YouTube page, where you guys can please feel free to share with anyone that might be interested. Thank you all so much, and I'll see you next time for our next PHEd Talk.